pancreas is a thin, slender organ in the upper abdomen, just behind the stomach. And its main role is to produce digestive enzymes to help the breakdown of food and also to produce hormones like insulin. A cyst is a small collection of fluid either within or on the pancreas, which we see on usually non-invasive imaging that a patient's undergone. And the decisions we need to make about that then is whether it might be inflammatory or whether it might be a true cyst of the pancreas, and we do further tests to look into that. So the Cellvicio system gives us extra information over endoscopic ultrasound. So that means we can look at the cells directly inside the cyst and make a decision then and there about whether they might be benign type cells or whether they might be malignant. The first things that we think about when we first find a pancreatic cyst in a patient who may have had a scan, for example, for other reasons, we try and determine whether it's actually been causing any symptoms for the patient. So we ask them about abdominal pain, whether they've become diabetic, whether they've had pancreatitis or have become jaundiced. We look at the location and the size of the cyst, which are important. So small cysts, less than 1 centimetre in size, generally of not concern, but larger cysts, particularly if they have a solid component, are more worrying. And location, whereabouts it is in the pancreas, because there's different approaches depending on whether it might be in the large head of the pancreas, which is just adjacent to the small bowel, or in the tail of the pancreas. So how does a person decide whether the Cellvicio system is the right for them? Really, we make those kind of decisions in conjunction with the patient and the multidisciplinary team. But from a patient perspective, I think the Cellvicio system gives more information, and also it gives a more accurate answer. The survival rate for pancreatic cancer overall is very poor, although survival is much better if it's caught in time and people undergo curative surgery. Benefits for Cellvicio is that if we see cancer cells at the time of doing Cellvicio, then we can be confident about informing the patient they really need an operation then and there. If we see a cyst which is benign and which doesn't have any potential for cancerous change, then we can be equally confident to inform the patient about the good results and that they don't need an operation.